Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
In that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen, and I thank you so much for listening today. As always, go check out reallifepharmacology.com. Just by subscribing via email, we'll get you a 31-page PDF on the top 200 drugs. Great refresher if you're out in clinical practice, as well as if you're taking pharmacology courses or taking board exams soon. Definitely, I think, a helpful real-world kind of experience where I shared my most important clinical pearls with those top 200 drugs. So you get that absolutely for free for subscribing to reallifepharmacology.com. And obviously, we'll get you updates when we got new content, new podcasts, and things available too. So again, go check that out, reallifepharmacology.com. All right, so let's do the drug of the day today, and that is Propranolol. Brand name of this medication is Inderal. And in clinical practice, I feel like I'm seeing it less and less, but there definitely are certain circumstances that I do feel that I see it from time to time for sure. So this drug is a non-selective beta blocker. We did a general overview of beta blockers, but I definitely wanted to dig down into a little bit more specifics with propranolol specifically here. So it has, if you look it up, it has tons of indications. Hypertension, tachycardia, atrial fibrillation, post-MI, chronic stable angina, so lots of cardiovascular indications. And I can tell you from a clinical practice experience, it's virtually never used for just that specific reason. And one of the reasons being it's a non-selective beta blocker. So generally there's probably going to be a broader adverse effect profile or more risks potentially with using propranolol compared to a cardioselective agent such as metoprolol, for example. So that's why you really don't see it used very often for cardiovascular things. Now, so there are some kind of more oddball type indications that I definitely do see it occasionally used for. So essential tremors, an example that I've seen it used for quite a bit. Migraine prophylaxis, another potential situation there. Esophageal varices, maybe not quite so much anymore, but occasionally see that. Occasionally for performance anxiety disorders, kind of on a as-needed type of basis. Lithium-induced tremor, antipsychotic-induced akathisia, and thyroid storm is kind of one last one that occasionally you may see a non-selective agent like propranolol used for. So let's talk about that selectivity a little bit. So that adverse effect profile is going to be dependent upon propranolol basically being non-selective. So propranolol blocks beta-1 receptors, which is commonly kind of referred to as some of the cardiovascular type receptors, but it also has beta-2 blocking activity, and that's going to primarily impact, or at least where it's taught, it primarily impacts the lungs. So if you remember, a drug like Albuterol is a beta-2 agonist. Well, propranolol is going to potentially blunt that effect. So that can lead to bronchospasm and worsening of respiratory conditions such as asthma and COPD and other respiratory conditions as well. So that's one of the major issues with using a non-selective agent versus a selective beta blocker. Other adverse effects, we are going to drop that pulse, we're going to drop that blood pressure, so that can be good and bad, depending upon what we're trying to do there. Fatigue, definitely my geriatric patient population, fatigue is one of those adverse effects that I have seen. And sometimes it's maybe due just to the drug itself, but other times I've definitely seen maybe too aggressive of starting doses with propranolol. And so that's something to keep in mind as you start this drug and titrate up, making sure that we're not inducing too much fatigue there. And as part of my differential in like a polypharmacy type patient, so if you note that patients have to increase caffeine intake, or maybe even in severe cases, a provider's starting stimulants like methylphenidate because of, low energy and things like that, or maybe they're feeling that fatigue is due to depression, something like that. I'm definitely going to go back and look at that medication list and say, hey, are they on a beta blocker like propranolol, which can definitely induce some of those symptoms. Sexual dysfunction definitely has been reported with a drug like propranolol. And then also masking of some of the symptoms of hypoglycemia. That's another important consideration, particularly in your patients with diabetes and or those who have experienced hypoglycemic events. One last thing on the adverse effect profile that I definitely wanted to mention, really important, I think, patient education point. Abrupt discontinuation can potentially increase the risk for acute coronary syndrome type events, particularly in patients at risk for acute cardiovascular events. So it's really, really important to make sure that your patients are consistently taking the medication, and we don't have periods of, where maybe a patient goes on vacation and they forget their med. We don't have those periods of multiple days missed dosages, and that's due to that boxed warning risk of abrupt discontinuation, which could lead to an increased risk for cardiovascular problems. Dosage forms I did want to mention before we get into drug interaction. So there are, LAXL, immediate release type formulations. In practice, I have seen errors in mix-up due to these different formulations. So very, very important to, take that into account and making sure that if you're on the dispensing side, we're giving out the right medication. If you're on the medication administration side or taking the medication, definitely speak up and say something if you see that pill looks different than it used to look, okay? That might indicate that there may be a mix-up in long-acting versus immediate release type of dosage forms there. All right, so let's take a quick break from our sponsor and we'll wrap up with drug interactions. If you're in the market for pharmacist board certification study material like BCPS, BCACP, BCGP, BCMTMS, psychiatric exam, or even the NAPLEX if you're a pharmacy student, we've got links to tons of different content that are available to you. Your support there at meded101.com/store definitely helps grow our podcast and helps support financially this podcast as well, so all can benefit from it. So also, if you're a nurse practitioner, PA, med student, physician, all sorts of different resources, recent books on drug interactions, perils of polypharmacy. We've got some Audible books. We've got Amazon books. So lots of different ways if you like to consume content and have some refreshers or potentially learn some new things. So all those links to all those books, all the study materials, meded101.com/store, STORE. All right, so let's finish up with drug interactions, and there's definitely some significant ones to get to. So first off, I want to start with propranolol. It is a weak CYP1A2 inhibitor. So there aren't a ton of meds that follow the CYP1A2 pathway, but a drug like tizanidine, a drug like theophylline, concentrations could potentially go up on account of adding propranolol to a patient who's already taking those medications. Other examples, other things I wanted to talk about. So propranolol is broken down by CYP1A2 as well. So CYP1A2 inhibitors can increase concentrations of propranolol. So classic example, ciprofloxacin, fluvoxamine, an SSRI or Luvox brand name there. So those are a couple examples of meds that could increase propranolol concentrations. Inducers can reduce concentrations. So inducers of CYP1A2, those are many of your classic examples: rifampin, carbamazepine, phenobarbital. One unique one to think about is smoking. So smoking tobacco, that can actually lower concentrations of propranolol. So kind of an interesting one there to kind of think about and remember. And I believe in the clozapine podcast, I talked about that as well. So definitely go back and refresh yourself on that drug interaction as well. Now, additive effects, we definitely got to think about blood pressure and pulse. So blood pressure, first off, any blood pressure lowering medication can certainly have additive effects, but I also think of drugs that aren't classically referred to as antihypertensives. So, your PDE5 inhibitors, such as like sildenafil, for example, your agents used in Parkinson's disease, such as Sinemet, that's a blood pressure lowering agent. So we've got to remember that those two can have additive effects when used with a drug like propranolol. The lowering of pulse or bradycardia risk, that can certainly have additive type drug interactions. So I think of centrally acting alpha-2 agonists such as clonidine, for example, that can have additive pulse lowering effects. Dementia medications that you might not think of, the acetylcholinesterase inhibitors can drop pulse as well. So your donepezils and your rivastigmines, for example. So that can certainly have additive effects there too on the pulse lowering effect. Of course, we need to mention beta agonists used in respiratory diseases. So I mentioned your, albuterols and things of salmeterol, things of that nature. Propranolol can potentially blunt the benefit. It can block the effects of those beta agonists. So you've got to watch your patients who are taking inhalers closely because propranolol can worsen respiratory status. Really, really important there. And then I also look at that medication list and think about our patients with diabetes. If you see patients on sulfonylureas, insulin, you got to remember that these patients are at hypoglycemic risk, and propranolol can potentially blunt some of those symptoms of hypoglycemia. So that's really, really important to remember, really, really important to educate patients on. And I think that's going to wrap up the drug interaction section for today. If you enjoyed this podcast, leave us a rating, review on iTunes or wherever you're listening. That's greatly appreciated. Share us with classmates, colleagues, definitely anyone who could benefit from pharmacology education. We greatly appreciate you all sharing that and obviously helping this podcast grow. Go support the sponsor, meded101.com/store. Your contributions there directly help us keep this podcast funded and help us keep it going with new drugs and new medications that are coming out. So you guys can be on the front lines learning about them and obviously helping to expand your clinical knowledge base. Go to reallifepharmacology.com, sign up there, get the free PDF, of course. And as always, if you have comments, suggestions about what drugs to cover or any other issues you may have experienced, don't hesitate to reach out, mededucation101@gmail.com, or else track me down on LinkedIn is the social media network that I'm most active on. All right, well, I'm going to sign off for today. Thank you so much for listening. Hope you found this beneficial, and I hope you have a great rest of your day.
Hello, it is Ryan, and I was on a flight the other day playing one of my favorite social spin slot games on ChumbaCasino.com. I looked over at the person sitting next to me, and you know what they were doing? They were also playing Chumba Casino. Coincidence? I think not. Everybody's loving having fun with it. Chumba Casino is home to hundreds of casino-style games that you can play for free anytime, anywhere, even at 30,000 feet. So sign up now at ChumbaCasino.com to claim your free welcome bonus. That's ChumbaCasino.com and live the Chumba life.
No purchase necessary. VGW. Void where prohibited by law. See terms and conditions. 18+.